Now, Rhode Island's ongoing health care crisis. Attorney General Peter Nerona says he's requiring Brown University Health to take on 40,000 new primary care patients over the next 4 years to address a critical shortage in the state.
The decision is a major condition of a new merger deal for Brown Health as they absorb Brown Physicians Incorporated. Kate Wilkinson joins us with what patients need to know. Kate?
Well, they may sound very similar, but they're actually two completely different companies. And what this means is that the largest healthcare provider, Brown University Health, is taking on yet another company. But Attorney General Peter Nerona says he's able to justify this because it will make Brown Health more competitive with insurance companies.
After a year-long antitrust investigation, Attorney General Peter Nerona says his office has approved a merger between Brown University Health and separate entity Brown Physicians Incorporated.
Provided that Brown and BPI, once coming together, take significant steps to address and alleviate the primary care health crisis facing our state.
In the newly approved deal, Brown Health is required to take on 40,000 new primary care patients and hire 27 physicians over the next 4 years. The deal also requires them to get wait times down to less than 2 weeks for new patients. BPI Executive Director Dr. Angela Caliendo says this will make things more efficient for patients.
Instead of being in multiple patient portals, seeing one physician that didn't know what was done at another physician's office, a lot of that should be improved.
The merger represents yet another acquisition for Rhode Island's largest healthcare provider, but Nerona pushed back that this merger will hurt competition.
If this gives Brown some more power in the marketplace, then I don't necessarily see that as a bad thing. I think the marketplace in some ways is tipped too heavily in favor of insurers.
Yet he said his office is willing to hold Brown Health accountable if it doesn't hit that patient quota.
They're going to have to give us a good explanation why. Because we have suspended our antitrust investigation based on that commitment.
The merger is officially expected to take effect tomorrow. However, Brown Health says it's going to take at least a year before you might notice this as a patient, as it's going to take them a while to get Brown Physician transferred over to their system. In Providence, Kate Wilkinson, 12 News.